What triggers recurrent UTIs, and how can I find them? Imagine having a urinary tract infection that keeps coming back, making everyday life uncomfortable. Recurrent urinary tract infections are quite common, especially among women, and understanding what causes them can help you manage and prevent future episodes. Most recurrent UTIs are caused by bacteria, mainly Escherichia coli, which is responsible for the majority of urinary infections. These bacteria can enter the urinary tract through the urethra and sometimes hide inside bladder cells, forming reservoirs that are hard to eliminate completely. If the initial infection isn't fully treated, residual bacteria can cause it to come back later. Frequent sexual activity can also increase the risk because bacteria from the genital or anal areas can be introduced into the urethra during intercourse. Using spermicides or diaphragms can disrupt the natural balance of bacteria in the vagina, reducing protective bacteria like lactobacillus, which normally help prevent infections. Hormonal changes, especially after menopause when estrogen levels drop, can weaken the tissues of the vagina and urethra, making infections more likely. Structural issues in the urinary tract, such as urethral diverticula or bladder prolapse, can cause incomplete emptying of the bladder, creating a perfect environment for bacteria to grow. Medical conditions like diabetes or kidney stones can impair immune defenses and make infections more persistent. Additionally, emerging research suggests that an imbalance in gut bacteria and chronic inflammation may contribute to recurrent UTIs by providing a continuous source of bacteria or impairing immune responses. To find out what triggers your recurrent UTIs, a healthcare professional will review your medical history and symptoms, noting when infections happen and what might be related, like sexual activity or menstrual cycles. Urine tests, including urinalysis and cultures, help identify the bacteria involved and determine the best antibiotics. Imaging tests such as ultrasounds or cystoscopy may be needed if structural abnormalities are suspected. Sometimes, evaluating vaginal or gut microbiota can offer insights into persistent infections. In complex cases, specialized tests to detect bacterial biofilms or intracellular bacteria reservoirs might be considered. From a bladder health perspective, maintaining good hydration, practicing proper hygiene, and managing sexual activity carefully can help reduce risks. Chronic inflammation from repeated infections may irritate bladder tissues, and while recurrent UTIs are not directly linked to bladder cancer, ongoing inflammation is a known risk factor for some bladder conditions. If infections keep coming back despite treatment, it's important to seek thorough medical evaluation to rule out underlying issues like anatomical abnormalities or even bladder tumors. In essence, recurrent UTIs are caused by a combination of bacterial persistence, host factors like anatomy and hormones, and lifestyle influences. Identifying your personal triggers involves a comprehensive approach that includes medical history, laboratory testing, and sometimes imaging. Always consult a healthcare professional for personalized advice and treatment options, as each person's situation is unique. Taking steps to understand and address these factors can help you regain control over your bladder health and reduce the cycle of recurrent infections.